somebody needs to point like when I am pointing. So for example, nasal bone. Here is the nasal bone, and this is the frontal bone. And here between the two eyes, this is glabella. And this is the supraorbital margin. This margin is the supraorbital margin. Now we move to the parietal bone. So these two are the parietal bone, and these two cheekbones are the zygomatic bone. Lacrimal bone is this bone here, is the lacrimal bone. This one in the orbit, eye orbit, this is the lacrimal bone, and this bone here is the temporal bone. This whole bone is the temporal bone. In the temporal bone, you need to know the zygomatic process. So this process which is coming out from the temporal bone is known as zygomatic process of the temporal bone. And this is the zygomatic arch. This is the zygomatic process. Mastoid process in the temporal bone. So, mastoid process in the temporal bone, this blunt part is the mastoid process, and these spiny projections, they are the styloid process. In the temporal bone, you need to know external acoustic meatus. This is the external acoustic meatus, this one. So now we are done with the temporal bone. Now we move to the maxillary bone. So here is the maxillary bone, this one. And in the maxillary bone, you need to know the actually alveolar margin. So like these teeth are inserted here in the sockets, and this is the alveolar margin. And in the maxillary bone, you also need to know infraorbital foramen. So infraorbital foramen are these two. Like these are the eye orbits, and these two foramen here are the infraorbital foramen. Maxillary bone we can see from this view also. So when you look at this view, you see this is maxillary bone, this one. So we can see from the front as well as we can see from this view. Now, occipital bone. Occipital bone is now these two are the parietal bones, and here is the lumboid suture. So this whole big bone here, this big bone here is the occipital bone. In the occipital bone, you need to know the occipital condyles. So occipital condyles are these. These are the occipital condyles. This large hole through which the spinal cord will pass is the foramen magnum, and this is the external occipital protuberance, this one. External occipital protuberance. Now, sphenoid bone. Sphenoid bone is this butterfly shaped bone is the sphenoid bone. In sphenoid bone, you need to know the sella tertia. So see this shallow depression is the sella tertia, this one. This is the sella tertia. You also need to know in this one foramen lacerum. So foramen lacerum is these two holes here are the foramen lacerum. Then these oval shaped holes, those are foramen ovale, and the tiny holes are the foramen spinosum. So sphenoid bone, sella tertia, foramen lacerum, foramen ovale, and the foramen spinosum. Then in this sphenoid bone, you need to know the pterygoid process. So we need to go this side, other side. And these process here, these process here are the pterygoid process. And you also need to know the optic canal. So optic canal, we will take this one and put it into the optic canal. So this is going through the optic canal. We have on both sides. We can take out from this side and can put it. So see, this is the optic canal. That is also in the sphenoid bone. So now we will move to mandible. This bone here is the mandible. This bone here is the mandible. In the mandible, you need to know the mandibular condyles. So mandibular condyles are these, which have a smooth surface. You need to know the coronoid process. So these triangle shape are the coronoid process. Between mandibular condyle and coronoid process, this is the mandibular notch, this one. Then mandibular ramus. So mandibular ramus is, this part here is the mandibular ramus, and this is where it is making a turn is the mandibular angle. So mandibular angle, mandibular ramus, mandibular notch, condyloid process, coronoid process. Then you need to know the mental foramen. These tiny holes here near the chin, these are the mental foramen, these ones. You need to know the mandibular foramen too. So mandibular foramen is here, like this one and this one. Those are the mandibular foramen, and this is the place where the dentist will give the injection to make it numb. Mandibular foramen. So we are done with the mandible. Now, the vomer bone. So vomer bone is here. We can see it from the anterior side, and we can also see from the from the back. So here is the vomer, and then you need to know, okay, mandible, vomer bone. Then the palatine bone. So palatine bone, you need to go here like this. This is the maxilla, and this is the palatine bone, this one. So from here to here is the palatine bone. In the palatine bone, here is the greater palatine foramen. So palatine bone, greater palatine foramen. Now we will move to ethmoid bone. Ethmoid bone we can see from the anterior, like here is the lacrimal bone. Next to the lacrimal here, this is the ethmoid bone. Then we will see ethmoid bone from this side, like this is the ethmoid bone, this one. In ethmoid bone, this projection here is the crista galli, and on both sides, this is the cribriform plate. These tiny, tiny foramen are the olfactory foramen, these tiny, tiny. So crista galli, cribriform plate, and the olfactory foramen. Now, you need to know the middle nasal conchae and the perpendicular plate. So here we go in the nasal cavity. Here we have the vomer, and this plate you are seeing, which is dividing the right nasal cavity and the left. So this plate in the middle is the perpendicular plate. Middle nasal conchae are on the lateral side. So if you see middle nasal conchae, inferior nasal conchae. So these bony projection here on the lateral wall, both sides, are the middle nasal conchae. Now we will go through the sutures. So it says sagittal suture. This is the sagittal suture between two parietal bones. This is the coronal suture between the frontal and the parietal. A squamous suture is here between the parietal and the temporal. So this serrated line here is the squamous suture, and the serrated line here, like between the parietal and the occipital, this serrated line is the lumboid suture, and the frontonasal suture is, here we have the frontal bone, here we have the nasal bone, so this suture here is the frontonasal suture. So we are done with the skull, and